Hello, everyone. Welcome to the Fertility Happy Hour with Sandra and Leanne. We are back again.
Hi. We missed you guys.
We are super excited with this new episode, but we feel the need to explain our absence and why we haven't done a podcast in a while.
I know. It has been a very long time.
Yeah.
I feel like.
But
yeah, we've just been really busy.
We've been doing some really cool stuff. Sandra and I are just hopping all over the place. Sandra is now a certified Reiki practitioner. And very, very cool stuff she's doing with our clients and super interesting.
It's been really awesome. It's really been helping them for sure. So it's a really good tool to have in our toolkit.
And much needed for sure.
Yeah. It is.
Yeah. So we also did an ebook for patients that are going through IVF and how they can best prepare. And we're creating some new products, fertility products.
Mm-hmm. And the ebook you can find on our website. So anyone interested.
Yes, it's ready and available for purchase. Mm-hmm. And it's super helpful. What else? Anything else?
We just started doing virtual coaching.
And yes,
it's been really, really amazing. I feel like we've had one client, just to be transparent, but, it's done wonders for her. And it was just something that we kind of wanted to pilot, and it was really successful, so and we're excited to do that.
And it's opened a whole new world of getting to treat patients that are not local to us or able to drive, and they could really benefit from our treatments. And it's super cool. We're so excited. If you guys are interested, reach out. We're gonna establish it and get it going, and it'll be on our website available for you guys as well. So
yes. And this episode, this podcast episode, I think it's really eye-opening for a lot of people that are thinking about doing IVF and, just kind of wondering if they want to go that route. Dr. Schumacher with Shady Grove Fertility, she's been with them for 6-7 years now. But she's just awesome. I love talking to her because she's just like real.
She is. Yeah. And she debunks all the fears that you may or may not have with going the IVF route. And, it's just very informative, and it's a great idea. Just, if you're even considering just making a decision about what pathway you're going to take, and it's just a lot of great information to just sit down and talk with her.
Yep. Yeah, it really is. And, we do give information at the end of the podcast. If you are interested in setting up a consultation with her, you can get in touch with Shady Grove. And it doesn't have to be as daunting as you think it is. So I think this is just a really good episode for a lot of people, because sometimes, and one of the things that Dr. Schumacher says, and listen to the whole podcast, but I'll give you a little tidbit. She says one of the things is that she wishes women wouldn't wait too long to make an appointment just to get information, So I think that's, really key. I love getting information from anyone. Yeah. So a consultation doesn't really cost much, with healthcare. You can put on your insurance, so it's not like you're spending a ton of money. So
very helpful.
So this will be a really great episode for you guys, and we promise that we will be more consistent with coming out with more podcasts on a regular basis as soon as things kind of start to slow down for us. But right now they're revving up again, just with in-person clients. We're just getting too popular, Leanne.
I love it.
We're going to have to clone ourselves.
I love it. Keep them coming.
I do too. We're really making a huge difference with women. And we're making a big impact on fertility. And that's kind of what our mission was from when we started this, is we wanted to make a difference in the fertility world. Yeah. And I feel like our voices are finally starting to be heard.
Yes.
Even though I lost my voice this week, but our voices are starting to be heard.
Yes. So sit back and enjoy this episode. It's really cool. And we look forward to posting again the next podcast. Enjoy.
Yay. Enjoy.
Welcome to the Fertility Happy Hour with Sandra and Leanne, your fertility besties. We're here to bring some fun, laughter, and a new perspective to your fertility journey and give you lots of tips, hints, and tricks along the way. So sit back with your favorite mocktail or a cocktail and have some fun. Oh, here we go.
we go.
There we go. So welcome back. We are Sandra and Leanne, and we are from Reinvented Fertility. And today we are speaking with Dr. Brianna Schumacher, who is a well-known fertility specialist in our area. And how many years of experience, Dr. Schumacher, do you have? I couldn't get this on your bio.
I've been at Shady Grove. This will be my 6th year. And then I've been practicing for probably close to 10 years now.
Awesome.
Including like fellowship and yeah.
Yes. I have to say, very stylish fertility.
Thank you. I try. I get myself like a boost in the morning, got my
I know.
jumpsuit on, ready to go.
I love that. Is it velvet?
Yeah. Yep.
And Dr. Schumacher herself, what, you have like 4 or 5 kids?
I have 5 kids.
5 kids.
Yeah. Tiny humans. My eldest is almost 10 and my youngest is 18 months. So
yeah, that's amazing that you actually can leave the house looking put together, because it's it's a struggle with me, and I only have 2. So
it's a jumpsuit's easy because it's one thing to think about. So that's why I have so many other
that's
fun
true.
thing, and then earrings and then go. And that's no matching for me. So
oh my gosh. Now you were just telling us before we start recording that this is like the busiest time, one of the busiest times for you guys. Can you say again why? Because I thought that was kind of funny. Not funny.
Yeah, I was just saying, the fall tends to be busy, and then the new year. And it's interesting because I feel like in the new year, just like I have all my New Year's resolutions. The one thing is like, people are like, oh, I need to like go to the gym, and also I need to get pregnant this year. And so we're seeing, they say it kind of like in jest, but it's sort of, everybody's ready to get going and meet with the person they don't want to meet with, which is the fertility doctor, to kind of like get going on their fertility journey or pregnancy or family building.
and it's so funny because we actually do see that as like, it's like on the to-do list, like get pregnant, like it's like a thing
putting
to
it
accomplish.
off. I don't want to do it. I don't, not that I don't want to get pregnant, but I don't want to meet with somebody and them have them tell me there's a problem or that, they need help. It's hard. It's really hard. And so,
and that's like, it is interesting because it's not like, it shouldn't be like a scary thing, right?
No.
To see you guys. So like, what would you say? And what would you say is like, that would really comfort women, like, that you could tell them that to encourage them to come and not put it off?
Yeah, I think, I think especially, I know the way at Shady Grove that we approach it is basically we want to make sure that you guys have the information to do whatever it is that you want to do to build your family. And it shouldn't be scary. It's more, and every person that walks in the room is exactly, they're like so anxious, hardly can like say the words that they want to say. And by the end, I feel like most people are comforted by having a plan, because having a plan means that there's like a next step and like, I got this, like we're going to do this and this and this, and you don't need to do anything after you leave the room here. Someone's going to reach out to you. I just said this like 15 minutes ago, and they're like, you had so much information at the visit. And like, yeah, it's so much information. I would not absorb, even a few percentages of it. And so that's the reason that someone follows up afterwards in like the next day or two with like a to-do list. And it's just so nice to have something to like walk through and have someone help you walk through that. And then at the other end, when the to-do list is complete, they're going to help you schedule a follow-up visit so we can get back here and then go through like the next steps. And I think it's really like that plan and next steps, and not having like the unknown that is like much less scary for people after they leave here. So,
and I think a lot of women may be putting it off because they don't know for sure if they want to embark on IVF or IUI. So would it be, something that you recommend, like just coming in to see if it's a good fit for you,
Yeah,
or to see,
definitely.
you don't have to have your decision made, but just
No.
as an option.
No. I mean, and honestly, I say, the first thing is let's get some information, because most of the time I have no idea, even in just a conversation, I can sometimes have a little bit of an idea of what I think's going on. But at the end of the day, we just do some evaluation, just see if we can identify anything, and then we just go through and we talk about what are the options. And one of the options is always do nothing, continue to try and get pregnant on your own naturally. That's always an option. It kind of goes up, try to get pregnant naturally. If you're not happy with that, there's insemination, there's IVF, and we can just work our way through the ladder. But certainly there's no pressure to like pick something. It's more just like, what information do you need to be able to kind of understand what's going on and what are the options that you have based on that.
And I think that's why we really like resonated with you when we met with you the first time, because you don't, like, a lot of times, like, we will get women that come in and they say like they go to see, a reproductive endocrinologist or fertility specialist, and they just felt the pressure of having to, like, they're like, okay, yeah, like you should do IVF and we should get started right away. And I think with you, like, just saying that you don't pressure them, that you do give them their
No.
options and say
Yeah.
like, hey, you might be able to just do this naturally,
Yeah.
and here you go. And I think that's really important for women to understand that. And we always try to encourage people just to go get a consult, just to like get information,
Yeah.
like you give them. Yeah.
And the first visit is always just like an education visit. Like I think a lot of
Yeah.
people think they're going to come in, I'm going to tell them what test and then also what treatment, but that's definitely not the case. The first one is just, okay, this is how the reproductive system works. This is female fertility. We go through quantity, quality, fallopian tubes, like how does it all work together? And mostly because I think if I walked into some place and someone said, okay, go do this like thousands of tests, and then and there's like no reason why, like they didn't describe what the test is or why they're doing it or what does it evaluate, and then come back and see me, I'd be like, well, for what purpose? Like I'm so busy, like why do you want me to do those things? Can't we just get on with it? And really it is just like learning about how your body works,
Yeah.
and then kind of progressing through the steps until we're at a place where we're comfortable with whatever our next step is. So
Yeah, that definitely takes away the fear too. The unknown
Mhm.
is what causes the fear. So if they have, a clear understanding of, and more education on what's
Yeah,
going on.
education. It's like my
Yeah.
biggest mantra. Like it's your body, your choice, your family. I won't let you do anything dangerous. I always say that, and I'll give you my medical recommendation. But at the end of the day, if you're like, thank you so much for the information, I'm not interested. My feelings are not hurt. You get
Mhm.
to do whatever it is that you want to do to kind of move forward and feel good about it. So
Well, that's good to know that. I mean, I think women will, like I said, be comforted knowing that you're not going to be like, well, if you don't want my services, then like, screw you.
yeah.
Like,
Yeah.
you just
No,
wasted my
no,
time.
no. I see a lot of people just for even just like an education, like fertility discussion,
Yeah.
especially, single females, women who, have maybe just got into a new relationship and they're not sure, what their options are, or if they even want to have a family, just to kind of
Yeah.
go through and see, should they change their mind, what is available, that kind of thing.
Yeah.
Yeah.
That's
Mhm.
awesome.
Mhm.
So if you had to pick one thing, you see women that they could do possibly to affect their fertility success, what would you say that number one thing would be?
So I think, so actually, I was thinking about this question. I think the biggest thing is really not to fear having the discussion, because I think putting it off and putting off, the biggest thing that affects female fertility that we can't change and just go, it just happens naturally, is our age. And so no matter what age you are, like start right now, come in and see what things are like so that we can work forward from there and have like the best opportunity. So I think like delaying and that like hesitation is probably one of the biggest things that's like less concrete in terms of what can you do. In terms of like more concrete things, I think tobacco use is a big no-no. I think marijuana is a challenging one because we don't have a lot of good information on that one yet. The studies are kind
And
of
that's both for the women and their partners, or just like the,
yes. male and I mean, male is actually more well-defined in terms of how that impacts their fertility. And I always tell patients, you know, because a lot of people use marijuana, a lot of people use tobacco still. You know, not everybody who uses tobacco or marijuana is going to affect their fertility clearly, because there's so many people that it doesn't. You know, they still have large families or have kids. But at the end of the day, it's helpful to know if you're one of those people and how we can help improve that, either by helping people cut back or, you know, working around it. Some people, I recently had a patient whose partner used marijuana, and it was not possible for him to stop. It was really the only thing for like chronic pain, and that he could, and so he didn't have enough sperm to conceive naturally or through insemination. So, okay, we'll do IVF and understand, you know, that that's the only option that we have, and we can still help you build a family, because
Right.
changing this over here is not an option. So how else can we work through this? And so there's different ways that you can approach it.
Yeah.
You know, especially with a lot of the mental health stuff. I think it's important to understand how, when we're treating our mental health, either if it's with through anxiety medications or things like that, or even like some of the other alternatives like marijuana, et cetera, how does it impact your fertility, and how can we help you with that or work around that kind
Right.
of thing?
Well, so to kind of piggyback on that, on what you just said, how much do you think like a woman's mindset and mental health plays into or contributes to like the outcomes of your treatments? Do you think it's
I
like
think
a
mental health is huge.
factor?
I'm
Yeah.
a huge advocate of being in like, you know, it's hard because you don't want to say be in the best place that you can be when you're coming in here, because nobody's in the best place that they can be, when everyone's super stressed when they come in. But part of the goal is like, you know, I feel like there's two different personality types, and stress. If someone says to me directly, like, does stress affect things? Yes, it does, but not in the way that, like, if you're stressed, you're not going to get pregnant. I always compare it to like, in the grand scheme of the whole wide world, there are so many people that are more stressed than, you know, me here as an individual in the United States, in like famine areas and war-torn areas, and still able to get
Right.
pregnant, right? So it can't be like a direct, you know, cause and effect. But at the same time, mental health is so important, in being in the best place that you can be, to, because all of that positive energy and positive vibes and like everything that you can do to get into a place where you're comfortable and able to receive information and kind of work through things in a way that is going to boost you instead of bring you down, is like the best. And I always say there is two people. There's two people. One is the control person, who's like, listen, what can I do to improve things? And tell me
Right.
all those things, and I want to do those.
Yeah.
And it's like, what supplement should I take? You know, what is acupuncture? Like all these additional things. And should I do those? And I always say, listen, if you're the kind of person that really thrives on being able to control your environment, and you want to do those things, like, this is the list of things that you can do. And if that's going to make you feel less stressed, do that. But
Mhm.
also, if you're the personality that's like, I will do that if you tell me to do it, and but I'm not super happy about it, and it's going to make me super stressed to wonder if like this is in this thing, or, you know, what plastics can I use and all that sort of stuff, don't worry about it, because it's not going to make that much of a difference. Like, just be less stressed and don't stress about those things. It's not that impactful in the grand whole scheme of your fertility journey. So it just
Good rule.
depends on
Yeah. So
how you receive information, or how much information you want to use in your environment to control things.
So in the preparation of someone that wants to go through IVF, could you say that there are like a top, you know, one, two, three things that someone can do that will help them? Or would you say it kind of depends on the person? Like, so a type A personality, your advice would be like, hey, if you want to prepare for this, you need to back off and stop trying to control everything. Or would you, you know, would you in the
Yeah.
opposite
I
sense?
do think sometimes over control is a problem, because we as women especially are designed to, or not, well, design may be one, but also kind of trained, you know, work harder at this and you will get results. But fertility is actually not one of those things. That it's really hard, because it's like one of the things that we care the most about, but
Right.
we just cannot, you know, it doesn't matter how hard we work sometimes, like by ourselves at things, it's not going to change it, or may not change the outcome. And that's really, really difficult for, I think, especially women who are very, or can be very career driven, and have worked their way up to a place where they have worked harder and achieve results. And this is a very difficult conversation and thing for people to work through, because it's not work harder and you'll get results. It's
Right.
sometimes you just can't change the outcome, but we'll work with what we have and
Yeah.
help you get to the place that you want to be, whatever that place is. So,
Yeah, we
uh,
see that a lot with our clients, and we try to instill releasing some of that control factor, because
Yeah.
we have so much control. This isn't a control thing. So that's the number one thing I would say that we really try to work with.
And it's funny because you do see that kind of type A personality a lot with women and not so much with men. And I think that's why like the husbands or the partners are usually kind of like just really, chill.
Yeah. Yeah.
And they don't understand. They're like, you just need to relax,
Yeah.
and it's just so funny. It's like,
Yeah.
why don't you do the other way around where the men get pregnant?
Yeah.
Yes, I know, right?
Much more relaxed, right?
Yes. And that's why I do like having the partners here. I mean, it's not mandatory, and certainly I see women all the time by themselves, but I think having the men a part of the conversation, especially about reproductive windows of time for women, and egg quantity and quality, and how age really affects that. Like, that's a concrete thing that that they're numbers people. Okay, this is like, this is how many eggs we have. This is how many we expect to be normal. Like, they're numbers. So they absorb that information very well. And I think in that way are able to contribute as like a better supporter when they're part of the initial discussion. Whereas, even like my husband is, if I come home and like tell him, X, Y, and Z from the pediatrician, and he is like, it doesn't resonate the same way as if he was like actually there hearing the pediatrician say it to him.
Exactly.
Like, if he's telling him, it's not going to affect things, but
Oh,
having him sit there and listen to someone else tell him is much more impactful.
I used to actually, this is a funny story. I used to actually email my pediatrician before our visit and tell him
that's
tell
Yeah.
my son's father. Because I'm like,
Yeah.
he's not gonna
No one
listen to me.
listens to us.
Yeah. I'm like, but
No.
he'll listen to you. And he used to do it. He'd be like, got it.
Yeah. Yeah. It's totally true. I feel like, and sometimes I feel like the men are a little bit more hesitant. I'm like, just bring them to the next appointment. We can talk through it again, catch them up to speed. And a lot of the time it's all they need is just like, oh, I understand now. The numbers make sense to me. And, it helps so much to do that.
Yeah. And it just makes them like more a part of it. Cause I feel like women always think that they're doing all this stuff on their own.
Yeah.
But I mean, we agree to have a lot now, like with our practice, we're seeing a lot of the husbands starting to come in for like the initial.
Oh, that's great. That's awesome.
And like, you can really understand the clients, the patients better when you see the dynamic between the two.
And it's so much more beneficial, like you said. I mean, when I brought my husband and came to him, because I did IVF on my second, when I presented the option, he was like not happening, but then once we went into the appointment, it was like a complete turnaround. Like, so I think it coming from someone else is just so much more effective.
And I will say, I think some women have a hard time really getting their partners to come in. So I always say, you don't need to bring them. It's fine. You can just come by yourself and we can have a conversation. Like, don't, sometimes it's worse almost to pressure them into coming in. It has to be kind of like, eventually they'll, like start with like baby steps. You come, we'll like learn the information and we'll work our way up. And eventually he will become a part of the process. Cause I think there are some, and it's actually less and less frequently that I see this, but who are just adamant they don't want to be part of the process. And that's fine. We'll work with whatever we got. Like, you come in, we'll work through what is it that we can help you with specifically. And eventually he does need to be added on, but it doesn't need to be the pressure of everybody's on board right up front. Otherwise, sometimes that just like destroys it as well.
And that could be stressful for a lot of women too, thinking that they need their husbands or partners to be exactly where they are in terms of just every step of the way. But it's good to know that, it's okay for them to just
totally fine.
Be at different speeds.
Yeah, very much. And women are generally like way up here, and like we said, and like men are kind of like down here, like working their way up to the point where the female is.
Yeah. Now, have you seen in the years that you've been practicing over the years, have you seen any like significant shifts in fertility medicine?
In terms of, so I was thinking about this. I think the biggest things that I have seen are a shift away from, and this is probably not going to resonate with a lot of people, but I feel like people come in the past, and it used to be, if people were going to start fertility treatment, it's start like with the insemination and work your way up to IVF if you need it, right? And that is the mentality for a lot of people, and totally fine. But more and more, because fertility is becoming more accessible to people, fertility treatments, more and more insurances are paying for it. Like, the cost is coming down, but more importantly, like the success is going up. And so in the past, IVF used to be way more costly and also much less successful than insemination. Like insemination, we would say for the average person, about an 8 to 10% chance of pregnancy per month or per insemination. And IVF used to be like a 2 to 4% chance. So why would anybody ever start with IVF if it's much less costly, or if it's much less effective and way more costly? Whereas now the balance has kind of shifted. And so, especially where women are having babies at later ages and maybe want larger families, sometimes it is an option. I think people feel a little bit nervous about being like, sometimes, can I skip over the insemination and go right to IVF? And yes, you can. You can do whatever you want. You can start again, like I said, as long as it's not dangerous. What does that mean? Your tubes are open. As long as your tubes are open, certainly insemination is an option. But more and more, because it's covered by insurance and people want larger families, they can skip over whatever part they want. It's really like I said, whatever you want. So that's the biggest thing I see is one of the biggest things from like a treatment perspective. More and more I see women who are coming in and doing it on their own is the other thing. So especially since the pandemic, single females who are like, I am not sitting around waiting for somebody anymore. Like, I am ready now. I've achieved where I want to be in my career. I have, family support or significant like friend or social support around me. I'm just going to go ahead and have a baby. And I'll tell you that like it used to be like one every couple months pre-pandemic, and now it's like once a week or once or twice a week. I think there's a lot of support groups for that now, like single parent by choice, who, and they kind of like all group together and become like their own family. And so that's another huge thing that I see is instead of just like egg freezing, which is another thing that we see a lot more of, but more just like, okay, I got my eggs, but also I also want to have my baby now. And those are for the future if I find somebody or, whatever it is, I want a second or third child. And that's the other biggest thing, which is really nice to see, especially from like a female empowerment.
Baby first, love later.
That's right. And I think I think before it is like, okay, I got to find a partner. I got to find a partner so I can have a family. And now it's like, why do I need to find a partner? I can just do this on my own. It's hard. It's not easy. But it's also not easy having, I have two parents and we both like each other a lot, and it's still very hard to like get through raising, being a parent. But it's, I always say, is it harder to be with somebody that you rushed into and maybe don't like as much at the end of the day, and now you have to make parenting decisions together with someone who you might not actually jive with? Or is it better to just do it yourself? Again, it kind of comes to a control thing, and you have control. That's your child. You make decisions. It's difficult in a different way, but these are the discussions I have all the time, like with a lot of my friends, but also patients. Yeah.
Sounds like you're doing a lot of counseling.
I know, I was gonna say, I'm like,
yes, I do. That's a lot of it is just like having conversations and trying to help patients figure out like what's the right choice for them, like, and where are they right now, or even not right now, but where do they see themselves in like a couple of years? Because a lot of it is like, I don't want to just help you have the one child that you have right now. Like, how many kids do you want? And like, let's plan for your whole family so we can either help space things apart properly or pursue fertility treatments that are going to be more helpful in helping you, achieve the final goal kind of thing. Whatever it is.
Yeah, that is awesome.
Well, so for our listeners, I'd like to just say that, if they are interested in getting, IVF, or if it's even like a question or just needs an understanding of what Dr. Schumacher is at Shady Grove Fertility in Chesterbrook. And do you see patients out of another office, or is it just Chesterbrook?
No, it's just out of Chesterbrook, but I see a lot of people virtually. So like all over like the country will just
nice.
I see that.
Yeah.
Okay.
So if there's someone who's like in Center City or even Maryland or wherever, and they have a specific person they want to see, they can do it virtually and then also monitor or do whatever they need to do at other offices. And I'll always be the doctor and my nurse will always be their nurse, but they can use the other like sites for testing anything they want. Yeah.
That's really cool.
Oh, that is really cool.
Or a lot of people like or live in Chesterbrook but work in the city, and so they'll go to the city like during treatment because it's like right around the corner from their office and do their percent of blood work, and then I'll be the one like reviewing the results and communicating with them. So it's kind of like a tech site kind of thing.
That's awesome, because we're seeing virtual clients as well. And so that's like a great option, even just to get, like I said, just for peace of mind, to get information. And you're so
less intimidating too, right? Because you don't have to like
less intimidating.
Yeah.
And you're not in the office, and you have a really cute office over there back.
Yeah.
But anyway,
It is very warm and inviting.
yeah. And then so while we're talking about you, can you just give us, just for fun, 3 fun facts about yourself? Because I just love finding out more people about
Yeah.
people.
So I was thinking about this earlier. I was like, oh gosh, what is so fun? There's nothing out there. So I guess like the biggest thing that some things I take pride in is that I'm Canadian. So I didn't intend to end up in the United States. I'm from Canada.
Oh,
Families in Canada. Yeah. So I went to med school in Milwaukee, which is where I met my husband. And like the first day of medical school, he like sat down next to me in like orientation, and we didn't start dating for like 2 years, or we were friends first, and then ended up in Massachusetts and North Carolina and then here. So I was always on my way back to Canada, and then we started having kids, and here we are. Here we are. So I got my American citizenship like recently,
that's
and
so cool.
Wow,
yeah.
congrats.
So that's one. So I guess that's kind of interesting. Second is that, so in terms of like this field specifically, like I always wanted to do this. I grew up like super interested in reproduction, and like I bred all sorts of animals. I bred like my horse, my hedgehog,
Wow.
hamster, rabbits. Yeah. And now actually,
I mean, like on your own, like you just kind of did it. You're like, here's a bunny
yeah,
and here's another bunny.
yeah,
I mean,
Oh my
yes,
gosh.
yes, yeah, yeah. From
do
like,
you
I
need a
think I was probably
license for
like
that, or
what's that?
do you need a license for that?
Oh yeah, yeah. No, actually I started doing it this year with my kids. So my eldest is like 10, but they ask a lot about reproduction, shockingly. But so we have rabbits now that we breed, and they had their first litter recently, and they are
Oh,
just,
that's so
That is really
cool.
yeah,
cool.
So
yeah.
it's like innate in your
Yeah.
blood.
And I
That
remember
is
people
so
used to be
cool.
like, oh, you like babies, you want to do OBGYN. I'm like, no, I mean, I love like I love kids, obviously, but I'm actually interested in reproduction. Like I just find it fascinating, like all the
That's so
basic science
neat.
behind it. So yeah, so I've always done it, and I just love it. I think it's so interesting. And I used to joke, oh, like I'll breed humans someday. And people were like, yeah, okay, whatever. And I was like, here I am, joke's on you. Right? And then the third, I can't really think of a third thing, but
Well,
I know.
that's pretty interesting though. I'll give you, is
yeah,
your husband a physician as well?
yes, he is. He's in orthopedics.
Oh, he does the orthopedics. Okay.
Where does he work?
He works in Reading, so he works at Penn State, St. Joe's.
Okay.
Nice.
Yeah, yeah. So he is like
So
a
you
bit
guys
of,
aren't smart at all.
well, I don't know if it's smart or just like very tenacious, get through it, but
Yeah, I mean, you definitely need to go through medical
yeah,
school.
I always say
So,
med school is less about being smart and more about like you can just get through it.
yeah,
Like
I
you
know.
can get through it. And then
Right.
if you
Yeah.
can just sign up, and get through it, you'll be fine. So
Super
Yeah.
cool.
You might die a couple times along
yeah.
that,
Yeah.
but
There's a couple times in there when we wasn't sure gonna make it through, but what
oh,
doesn't kill you makes you stronger. So
very true.
yeah.
Very cool.
Well-
Well, if you for our listeners, if they would like to see you or schedule a consultation,
Yeah.
what would be the best way? Like online or?
Yeah, so there's a new patient center you can call, and I think you guys probably have my number, but there's either the new patient center, or if you want and just ask for Dr. Schumacher, or obviously I love all of the people that I work with. I think they're all wonderful physicians and humans. And then if specifically, like if you guys have someone specifically, you can always email me. Sometimes that's faster to get them in as well. So
Oh, okay, that's good to know.
yeah.
Yeah.
Anyway, and I guess online probably they'll direct you to the new patient center and just ask for what region you want to be in or whatever doctor. So
Okay. And if any of your listeners need to come in for some holistic treatments from Sandra and I, we are
yes,
reinventing.
I actually have given your pamphlet for the online
Oh, for the
yeah,
IVF prep.
I had a patient who's like, what else can I do yesterday? And I was
Oh, good.
yeah. So
Nice.
I said, I reviewed this, I looked at it, it's great. And I think it's very helpful for the women that want to be able to do more, that like are like,
Yeah.
I'm good with the medical stuff. Like I can tell them like, these are the next steps, but if you want extra support, you guys are wonderful with that in terms of
Oh,
like
thank you.
helping mentally, emotionally, and psychologically, which is a huge portion of this entire thing,
I
keeping
mean,
people
it's
like
most of,
oriented.
so yeah, I actually just had a client and I did more. So I'm certified, I just got certified in Reiki. So
Yeah.
I did more like spiritual treatments with her
Yeah.
than like the actual physical treatment, but it's amazing how much these women need it, you know?
Yeah.
Oh
And
my gosh, it's a huge, I will tell you that like I actually like surveyed the group. I'm just going to pull it up here as a last thing. I said, guys, I'm doing this like podcast, like quick, 3 things that you would say people should do before they, launch into, into their fertility journey. And one of the doctors who I love, she said, pray. Seriously, people need to be in the best mindset before starting their journey.
That's great.
Meditation, journaling, whatever will help stress reduction is, and I was like, yes, that's it. You need to be in a good spot. So,
Yeah.
and if you're, like I said, if you're not there right now, just start, just like really, it's just like starting and you'll get there eventually. We can have all the resources to
And
help.
having the support, I think too, like, so Sandra and I are often, our clients like call us incessantly just to reach out if they're like freaking out about stuff,
Yeah.
and just, just kind of calming them down and know that they can reach out to someone that,
Yeah, I
because a lot
think
of
that's
times they can't talk
amazing.
to friends and stuff. So
Yeah. Awesome.
awesome.
Well, thanks, guys. I really appreciate it.
Well,
And
thank
it
you
was
so much.
Yeah, we
a fun
appreciate your
interjection
time.
in my day, so I'm gonna go off.
Yeah.
Wednesdays is sushi Wednesdays here, so we have all of us like as a team have sushi.
Oh,
God.
that's
Brings
fun.
our spirits back up, middle of the week hump day. So we
Yeah.
Perfect.
So now we know to go there on Wednesday.
Wednesday.
That's right, Wednesday. Send me your order. I'm the
All right,
official
next meeting
orderer.
that we have in person will be on.
Yeah, maybe we should have done this podcast in the office.
That's right.
Awesome. All right. Well,
Thanks again.
thank you.
Thanks,
I'll
guys.
talking to you.
Bye.
Bye.
Can you just end?
Yeah,
Okay. Oh.
Are you sure you want to start going into the cloud?
Well, that is a wrap of our latest episode of the Fertility Happy Hour with Sandra and Leanne. Hopefully you got some good takeaways from this episode. We really enjoyed talking with Dr. Schumacher, as we always do. Sometimes we meet with her in person, and like we mentioned in the beginning, we are collaborating with Shady Grove Fertility to do like an in-person workshop just to make people more aware of the resources that are available for fertility. I really think that fertility health is something that isn't spoken about enough. For some reason, it has been labeled, in the past, and maybe not so much right now, as being a little bit taboo to talk about. Some women felt like it was pegging them as like having something wrong with them, just feeling shamed and embarrassed. But just like other, impairment or, medical diagnosis that you have not had control over, it should be something looked at that, this is something that I have and something that could be quote unquote treatable, and at least, look into avenues that can help treat this. So that is going to be the point of the workshop. So if you guys are interested, you can always reach out to us to say, hey, let me know when the workshop is going on. It's going to be probably at Shady Grove in Chesterbrook, Pennsylvania. And also, if you want any information on our manual treatments or in-person treatments, or now we're offering virtual treatments, which it's going to encompass some Reiki, since I'm now Reiki certified, and hopefully going through Reiki 2 and master level Reiki soon. And we can show you some things that you can do manually on yourself, and then just like a coaching program, which has been really beneficial. We kind of started incorporating that into our in-person treatments, just kind of coaching women, supporting them, giving them like the emotional support that they need, but as well as like the medical support and the research and things like that. And it really has made such a difference in their well-being overall, whether or not they're going into IVF or just kind of continuing to try naturally. Every single client has said that they walked away feeling just so much better, just about life, and more hopeful and feeling healthier. And if anything, if you can take that away from working with us, I think that is a win. So reach out to us. You can look us up on our website, reinventivefertility.com. We're on Instagram at reinventivefertility, Facebook, reinventivefertility. You can email us at Sandra-Leanne at reinventiverehab.com. So hopefully you guys will continue to listen. We're going to try to put out more consistent podcast episodes in the future. So keep listening. And for those of you that have been loyal listeners, thank you so much. Enjoy your day.